A well-balanced and nutritious diet has many benefits. On the other hand, a diet lacking in nutrients may cause a variety of unpleasant symptoms. These symptoms are your body's way of communicating potential vitamin and mineral deficiencies. Recognizing them can help you adjust your diet accordingly. This article reviews the 7 most common signs of vitamin and mineral deficiencies and how to address them. Number 1. Brittle hair and nails. A variety of factors may cause brittle hair and nails. One of them is a lack of biotin. Biotin, also known as vitamin B7, helps the body convert food into energy. A deficiency in biotin is very rare, but when it occurs, brittle, thinning, or splitting hair and nails are some of the most noticeable symptoms. Other symptoms of biotin deficiency include chronic fatigue, muscle pain, cramps, and tingling in the hands and feet. Pregnant women, heavy smokers or drinkers, and people with digestive disorders like Crohn's disease are at the greatest risk of developing biotin deficiency. Also, the prolonged use of antibiotics and some anti-seizure medications is a risk factor. Eating raw egg whites may cause biotin deficiency as well. That's because raw egg whites contain avidin, a protein that binds to biotin and can reduce its absorption. Number 2. Mouth ulcers or cracks in the corners of the mouth. Lesions in and around the mouth may partly be linked to an insufficient intake of certain vitamins or minerals. For instance, mouth ulcers, also commonly referred to as canker sores, are often the result of deficiencies in iron or B vitamins. 1. Small study notes that patients with mouth ulcers appear to be twice as likely to have low iron levels. In another small study, around 28% of patients with mouth ulcers had deficiencies in thiamine, vitamin B1, riboflavin, vitamin B2, and pyridoxine, vitamin B6. Foods rich in iron include poultry, meat, fish, legumes, dark leafy greens, nuts, seeds, and whole grains. If you experience these symptoms, try adding the foods above to your diet to see if your symptoms improve. Number 3. Bleeding gums. Sometimes a rough tooth brushing technique is at the root of bleeding gums, but a diet lacking in vitamin C can also be to blame. Vitamin C plays an important role in wound healing and immunity, and it even acts as an antioxidant, helping prevent cell damage. Your body does not make vitamin C on its own, so the only way to maintain adequate levels of it is through diet. Vitamin C deficiencies are rare in individuals who consume enough fresh fruits and vegetables. That said, many people fail to eat enough fruits and vegetables each day. Make sure to consume enough vitamin C by eating at least 2 pieces of fruit and 3 to 4 portions of vegetables each day. Number 4. Poor night vision and white growths on the eyes. A nutrient-poor diet can sometimes cause vision problems. For instance, low intakes of vitamin A are often linked to a condition known as night blindness, which reduces people's ability to see in low light or darkness. That's because vitamin A is necessary to produce rhodopsin, a pigment found in the retinas of the eyes that helps you see at night. Symptoms of vitamin A toxicity can be serious and include nausea, headaches, skin irritation, joint and bone pain, and, in severe cases, even coma or death. Number 5. Scaly patches and dandruff. Seborrheic dermatitis, SB, and dandruff are part of the same group of skin disorders that affects the oil-producing areas of your body. Both involve itchy, flaking skin. Dandruff is mostly restricted to the scalp, whereas seborrheic dermatitis can also appear on the face, upper chest, armpits, and groin. Foods rich in niacin, riboflavin, and pyridoxine include whole grains, poultry, meat, fish, eggs, dairy, organ meats, legumes, green vegetables, starchy vegetables, nuts, and seeds. Seafood, meat, legumes, dairy, nuts, and whole grains are all good sources of zinc. Number 6. Hair loss. Hair loss is a very common symptom. In fact, Up to 50% of adults report hair loss by the time they reach 50 years of age. A diet rich in the following nutrients may help prevent or slow hair loss. Iron. This mineral is involved in DNA synthesis, including that of the DNA present in hair follicles. Too little iron can cause hair to stop growing or fall out. Zinc. This mineral is essential for protein synthesis and cell division, two processes needed for hair growth. As such, zinc deficiency may cause hair loss. Meat, fish, eggs, legumes, dark leafy greens, nuts, seeds, and whole grains are good sources of iron and zinc. Number 7. Red or white bumps on the skin. Keratosis pilaris is a condition that causes goosebump-like bumps to appear on the cheeks, arms, thighs, or buttocks. These little bumps may also be accompanied by corkscrew or ingrown hairs. The condition often appears in childhood and naturally disappears in adulthood. The cause of these little bumps is still not fully understood, but they may appear when too much keratin is produced in hair follicles. This produces red or white elevated bumps on the skin. Thus, in addition to traditional treatments with medicated creams, people with this condition may consider adding foods rich in vitamins A and C to their diet. These include organ meats, dairy, eggs, fish, dark leafy greens, yellow-orange colored vegetables, and fruit. A diet that provides an insufficient intake of vitamins and minerals can cause several symptoms, some of which are more common than others. Often, increasing your intake of foods rich in the appropriate vitamins and minerals can help resolve or greatly reduce your symptoms.